If your doctor recently told you that your creatinine is too high, or if you've been noticing foamy urine in the morning, waking up 2 or 3 times a night to use the bathroom, or feeling more tired than usual, I need you to stop scrolling and watch this video all the way through. Because what I'm about to share with you in the next few minutes could genuinely change the trajectory of your kidney health. My name is Dr. Jason Fung, and I've been a practicing nephrologist, that's a kidney specialist, for over 25 years. In that time, I've sat across from thousands of patients, many of them right here in the United States. Seniors just like you who came to me confused, scared, and unsure of what to do next. And one of the most common questions I get almost every single week is this: Doctor, is there anything I can eat to help my kidneys? And my answer today is yes, absolutely yes. But it depends on what you're eating, how you're preparing it, and how much of it you're having. Now, here's what scares me about what I see on the internet, and I'm going to be very honest with you. There are a lot of videos and websites out there making wild claims. Cure your kidneys in 3 days, or drink this and your creatinine drops overnight. That is not what this video is. I'm a doctor. I take my responsibility to you seriously. What I'm going to share with you today is rooted in real science, published research, and guidelines from organizations like the National Kidney Foundation and the Mayo Clinic. No miracle cures, no exaggerations, just the truth. And the truth is powerful enough on its own. Here is what we are going to talk about: the top 5 vegetables backed by real clinical evidence that can help support kidney function, reduce the burden on your kidneys, and in many cases help stabilize or gradually lower elevated creatinine levels when combined with the right lifestyle changes. And I'm also going to tell you something that most YouTube videos completely leave out: the preparation mistakes that can actually make things worse, even with healthy vegetables. Stay with me because that part alone could be a game changer for you. Before we dive in, I want to ask you something. If you've been told your creatinine is above 1.2 or you've been given a GFR number below 60, I want you to comment right now below this video and tell me where you're at. Just type your creatinine number or stage 3 or stage 4, whatever your doctor told you. I read these comments. My team reads these comments, and your story might help someone else who is watching this right now and feeling completely alone. You are not alone. Millions of Americans are managing this, and we're going to talk about it together. All right, let's get into the 5 vegetables, and I promise you number 3 is going to surprise you. Most people think it's bad for kidneys. The science says otherwise when you know how to use it correctly. Vegetable number 1, red cabbage. The first vegetable on our list is one that almost nobody talks about in the context of kidney health. And that right there is a problem because red cabbage might be one of the most kidney-friendly, creatinine-supportive vegetables available in any grocery store in America, and it costs almost nothing. Let me explain what creatinine actually is first, because I want you to understand the why behind everything we discussed today. Creatinine is a waste product. It's produced naturally when your muscles break down a substance called creatine, which they use for energy. Your kidneys are responsible for filtering creatinine out of your blood and excreting it through your urine. When your kidneys are working well, creatinine levels stay within a normal range, roughly 0.7 to 1.2 milligrams per deciliter for most adults. But when the kidneys begin to struggle, whether from chronic kidney disease, diabetes, high blood pressure, or other factors, they can't filter as efficiently, and creatinine starts to build up in the blood. That rising number on your lab report is a signal. It's your kidneys telling you they need help. Now, red cabbage, why is this vegetable so remarkable for kidney patients? There are 3 main reasons, and I want to walk through each one carefully. First, red cabbage is extremely low in potassium. This is critically important for anyone with CKD because damaged kidneys often struggle to excrete excess potassium. High potassium in the blood, a condition called hyperkalemia, can cause muscle weakness, heart rhythm problems, and in severe cases, it can be life-threatening. Many vegetables that are otherwise healthy, like bananas, potatoes, and tomatoes, are loaded with potassium and can actually be harmful in higher stages of CKD. Red cabbage contains only about 170 milligrams of potassium per half cup serving. That is genuinely low. It's a vegetable you can eat without constantly worrying about your potassium level spiking. Second, red cabbage is low in phosphorus. This matters just as much. When kidneys start to decline, They also struggle to remove phosphorus from the blood. High phosphorus levels pull calcium out of your bones over time, weakening them. It also calcifies blood vessels, which is one reason kidney disease patients have higher rates of cardiovascular problems. Red cabbage gives you nutrition without loading you up with phosphorus. Third, and this is where it gets genuinely exciting from a clinical standpoint, red cabbage is packed with anthocyanins. These are the natural pigments that give it that deep purple-red color, and anthocyanins are powerful anti-inflammatory compounds. Research published in journals like the Journal of the American Society of Nephrology has shown that inflammation plays a central and ongoing role in the progression of chronic kidney disease. It's not just about filtration, it's about inflammation in the kidney tissue itself, accelerating damage over time. Anthocyanins help interrupt that inflammatory process. They don't fix what's already lost, but they may help slow down further damage, and that matters enormously for your long-term trajectory. Now, here is the practical side and the mistake I see patients make constantly. They steam red cabbage until it's completely soft and mushy. That's not ideal. When you overcook red cabbage, you significantly reduce its anthocyanin content. Heat degrades these pigments. The best way to consume red cabbage for maximum benefit is either raw, shredded into a salad or coleslaw, or lightly steamed, just 2 to 4 minutes so it retains its color and crunch. If the color turns from purple to blue-gray, you've overcooked it. That's your visual cue. I also want to mention something nobody talks about. Red cabbage is mildly alkalizing in the body. Some research suggests that managing the acid-base balance in the blood, something called metabolic acidosis, is important for kidney patients. Metabolic acidosis can actually accelerate kidney function decline. A diet rich in plant-based alkalizing foods like red cabbage may help buffer against this. The National Kidney Foundation has noted the importance of managing acidosis in CKD patients, and dietary approaches are a real evidence-based part of that strategy. One serving of red cabbage 3 to 4 times a week is a reasonable, realistic, and kidney-friendly goal. It's inexpensive, widely available, and extraordinarily versatile. You can put it in salads, wraps, soups, or as a side dish, and it is one of the cleanest vegetables you can eat if you are managing elevated creatinine. Vegetable number 2, cauliflower. The second vegetable on our list is cauliflower, and I know what some of you are thinking. Cauliflower really, doctor? That's your big reveal? But stick with me, because the reason cauliflower belongs on this list goes much deeper than most people realize, and there's a specific preparation method that multiplies its benefits dramatically. Cauliflower has become trendy in recent years as a low-carb substitute for rice and mashed potatoes. But for kidney patients, its value goes far beyond carbohydrates. Let's talk about the 3 pillars of why cauliflower is exceptional for kidney support. First, like red cabbage, cauliflower is low in potassium and phosphorus. A half-cup serving of cooked cauliflower contains approximately 88 milligrams of potassium and only 22 milligrams of phosphorus. These numbers are among the lowest of any vegetable you can find, which is why the National Kidney Foundation specifically lists cauliflower as a kidney-friendly food in its dietary guidance for CKD patients. When your kidneys are struggling, every milligram of potassium and phosphorus you reduce from your diet gives your kidneys a little more breathing room. Second, cauliflower contains a remarkable group of compounds called glucosinolates, which are broken down in the body into indoles and isothiocyanates. These compounds have been studied for their ability to reduce oxidative stress. And here's why oxidative stress matters for your creatinine levels specifically. Oxidative stress damages the tiny filtering units inside your kidneys called nephrons. Once a nephron is damaged beyond repair, it cannot regenerate. The kidneys are one of the few organs in the human body that cannot regenerate their functional units. So protecting remaining nephrons from oxidative damage is not just helpful, it is foundational to any strategy for preserving kidney function. Third, and this is the point that very few people discuss, cauliflower is a significant source of choline, a capital B vitamin-like nutrient. Emerging research suggests that choline plays a role in reducing urinary protein excretion. That's the proteinuria, the foamy urine that many of you watching may be experiencing right now. Proteinuria is not just a symptom, it is an independent risk factor for kidney disease progression. High levels of protein in the urine mean the kidney's filtration barrier is damaged and leaking. Studies published in Clinical Nutrition and related journals have explored how certain plant nutrients, including choline, may help support the integrity of that filtration barrier. The research is early, but it's promising, and the fact that cauliflower delivers this alongside everything else makes it a standout. Now, the preparation method, here's the mistake I want you to avoid. Many people boil cauliflower in large amounts of water and then discard that water. The problem is that boiling leaches out both potassium and the beneficial phytochemicals into the water. The best methods for kidney patients are roasting it in the oven with a light drizzle of olive oil or steaming it, where the water doesn't directly contact the vegetable for extended periods. If you do boil, drain, and discard the water, this actually helps leach out potassium, which can be a benefit if your levels are high. Ask your nephrologist or renal dietitian whether leaching is appropriate for you specifically. And I want to bring in a real patient experience here, not using real names to protect privacy, but a scenario that represents what I see regularly. I had a patient, a 68-year-old gentleman from Tennessee, retired, managing stage 3 CKD alongside type 2 diabetes. His creatinine was running around 1.9. He came to me frustrated because he was trying to eat healthy, but kept making potassium-related mistakes. We worked with a renal dietitian and rebuilt his plate around vegetables like cauliflower and red cabbage. Over 6 months with dietary changes, proper hydration, and medication management, his creatinine stabilized at 1.7, and he felt more energy than he had in years. Diet alone didn't do it, but diet was absolutely part of the equation. That's the honest truth about how this works. 3 to 5 servings of cauliflower per week, prepared through roasting or steaming, is an excellent evidence-informed target for someone managing CKD or elevated creatinine. Vegetable number 3, garlic. I promised you number 3 would surprise you, and here it is, garlic. Now, I know that when many of you hear garlic in the context of kidneys, your first instinct might be concern. You've heard that kidneys with CKD have to work hard to process things. You've been told to watch your diet, and garlic sounds intense, medicinal even, but here's what the science actually shows. And this represents a genuinely underreported area of nephrology nutrition research. Garlic is not just safe for most kidney patients. When used appropriately, it is actively kidney supportive. Let me explain why, and I'll also tell you exactly who should be cautious. The primary active compound in garlic is allicin, which is produced when raw garlic is crushed or chopped. When you break the cell walls and allow 2 internal compounds, alliin and the enzyme alliinase, to react with each other. Allicin is a potent anti-inflammatory and antimicrobial compound. But for kidney patients, what matters most is its demonstrated ability to reduce blood pressure and reduce systemic inflammation, 2 of the most critical drivers of kidney disease progression. Let me be very direct about this. The number 1 cause of chronic kidney disease in the United States is diabetes, and the number 2 cause is high blood pressure, hypertension. The National Kidney Foundation confirms this in its published statistics. If your blood pressure is chronically elevated, it damages the delicate blood vessels that feed and surround your nephrons, slowly strangling your kidney's ability to filter. Any safe food-based intervention that can meaningfully lower blood pressure has direct kidney protective implications. A meta-analysis published in the Journal of Nutrition examined multiple controlled trials and found that garlic supplementation produced statistically significant reductions in both systolic and diastolic blood pressure in hypertensive individuals. The effect was modest but real, reductions of roughly 4 to 8 millimeters of mercury in systolic pressure. Now you might say, doctor, that's not a lot. But in the context of kidney protection, that level of sustained blood pressure reduction over months and years matters enormously. It's additive with medication, not a replacement for it. Garlic also has antifibrotic properties. This is the part that most people have never heard about. Kidney disease, particularly in later stages, involves a process called fibrosis, where healthy functional kidney tissue gets replaced by scar tissue, fibrotic material that cannot filter your blood. Animal studies and emerging human research have identified that certain sulfur compounds in garlic, including allicin and its derivatives, may help inhibit the activation of myofibroblasts, the cells responsible for this fibrotic process. This research is still developing, and I won't overstate what we know, but the mechanistic pathway is plausible and genuinely interesting. Now, here's the preparation insight that virtually no video shares. The allicin in garlic is only fully activated if you crush or chop it and then wait approximately 10 minutes before heating it. If you throw a whole clove of garlic directly into a hot pan, the enzyme allinase is immediately denatured by the heat before it can produce allicin. You get flavor, but you lose a significant portion of the therapeutic benefit. The correct technique, confirmed by food scientists at Cornell University, among others, is to crush or finely chop your garlic, let it rest for 10 minutes at room temperature, and then add it to your cooking. This simple 10-minute wait can dramatically increase the amount of beneficial compounds that survive cooking. The appropriate amount for most people is 1 to 2 cloves of fresh garlic per day incorporated into cooking. Garlic powder and garlic salt are not equivalent, particularly garlic salt, which obviously adds sodium, something kidney patients absolutely need to minimize. Fresh or freeze-dried garlic is your best option. Who should be cautious with garlic? If you are on blood thinners like warfarin or Plavix, discuss increased garlic intake with your doctor before making changes. Garlic has mild anticoagulant properties. And if you are in a very advanced stage of CKD stage 4 or 5, please work with your nephrologist and renal dietitian before making significant dietary changes of any kind, because the nutritional rules in advanced CKD are significantly different and more individualized. For most people watching this video managing stage 1 through stage 3 CKD, or simply dealing with elevated creatinine without a formal CKD diagnosis, garlic is a remarkably safe, scientifically grounded, and multi-mechanistic ally. Before we get to vegetables 4 and 5, and I want to be honest with you, 4 and 5 are the ones that my patients always ask me the most follow-up questions about because they are genuinely surprising. I need to pause for just a moment and ask you a favor. If this information has been helpful to you, if you've learned something new, if you feel like this is the kind of medical content that is clear, honest, and respectful of your intelligence, please tap the like button right now. I mean it. That one simple action tells YouTube to share this video with more seniors who are sitting at home, confused about their lab results, not knowing what to eat, and feeling afraid. Your like could genuinely reach someone who needs this information tonight. And if you haven't subscribed yet, please do. We are working toward 100,000 subscribers, and every single one of those subscribers represents a person who has chosen to take their kidney health seriously. Join us, hit subscribe, and hit the bell so you don't miss our next video, where we are going to talk about the specific morning habits that accelerate kidney decline. Habits that your doctor may never have mentioned to you. And down in the comments, tell me which of these vegetables you already eat regularly and which one surprised you most so far. I genuinely want to hear from you. Let's keep going. Vegetable number 4, red bell pepper. Vegetable number 4 is the red bell pepper, and this one has a particularly interesting story because it is one of the most nutrient-dense vegetables you can eat, yet it's low in almost everything that kidney patients need to restrict. When I describe it to my patients, I call it the precision vegetable. It gives you extraordinary nutritional value with minimal metabolic cost to the kidneys. Let me explain what I mean. Red bell peppers are extraordinarily high in vitamin C. One medium red bell pepper contains approximately 190 milligrams of vitamin C. That's more than double the daily recommended intake for adults. And before you worry about vitamin C and kidney stones, let me clarify something important that I hear confused constantly. The research on vitamin C and kidney stones applies primarily to very high dose supplementation. We're talking about 1,000 milligrams or more from supplements. Dietary vitamin C from whole vegetables like red bell peppers does not carry the same risk for most people, and the benefits to kidney patients are significant. Here's why vitamin C matters for your kidneys. The kidneys are surrounded by and permeated with blood vessels that are highly vulnerable to oxidative damage from free radicals in the body. Vitamin C is one of the most potent water-soluble antioxidants in human nutrition. It neutralizes free radicals, protects endothelial cells, the cells lining your blood vessels, and supports the structural integrity of the kidney tissue. A study published in Kidney International found that lower levels of vitamin C were associated with greater prevalence of kidney dysfunction. While this was observational, the mechanistic rationale is well established. Oxidative stress is a driver of CKD progression, and vitamin C directly counteracts oxidative stress. But here's the part that most people don't know about red bell peppers. They are also a source of lycopene, the same antioxidant found in tomatoes that has been studied for its protective effects on the cardiovascular system. Now, tomatoes are typically restricted in kidney diets because of their potassium content, but red bell peppers give you a lycopene boost with a much more kidney-friendly potassium load. A medium red bell pepper has about 250 milligrams of potassium compared to over 400 milligrams in a medium tomato. That difference matters when you are managing your daily potassium budget. Red bell peppers are also virtually phosphorus-free in significant amounts, and they contain fiber that helps support gut microbiome health. This last point deserves more attention than it usually gets. Emerging research from institutions like the Cleveland Clinic has highlighted the gut-kidney axis, the relationship between gut bacteria composition and kidney health. When the gut microbiome is imbalanced, what's called dysbiosis, certain bacteria produce uremic toxins like indoxyl sulfate and p-cresyl sulfate that are absorbed into the bloodstream and further damage the kidneys. A diet rich in plant fiber, including from vegetables like red bell peppers, helps feed beneficial gut bacteria and may reduce the production and absorption of these toxins. This is a relatively new frontier in nephrology, but it's a real one, and the National Kidney Foundation has begun incorporating gut health considerations into its research priorities. The preparation insight for red bell peppers is straightforward, but often missed. Raw red bell peppers give you the highest vitamin C content because vitamin C is heat sensitive and degrades with cooking. A simple chopped raw red bell pepper, eaten as a snack with a little hummus or added raw to a salad, is nutritionally superior to a roasted one if your primary goal is vitamin C delivery. If you prefer cooking them, use quick, high-heat methods like sautéing for just 2 to 3 minutes rather than long, slow roasting to preserve more of the nutrient content. Aim for half to 1 full red bell pepper per day. It's sweet enough that most people enjoy it, even those who aren't big vegetable lovers. And unlike some of the other vegetables on this list, red bell peppers are genuinely palatable to most seniors, even those with changing taste preferences due to medications or age. Vegetable number 5, asparagus. We've arrived at vegetable number 5, and this one I want to spend a little extra time on because there's a nuance here that I see misunderstood both online and frankly in some clinical settings. The vegetable is asparagus. Now, asparagus has a complicated reputation. Most of you are aware that asparagus makes your urine smell different. Some of you have heard that asparagus is a diuretic and wonder if that's safe for your kidneys, and some of you may have even been told to avoid it. I want to address each of these points carefully because the science tells a more interesting and more encouraging story than you might expect. First, let's address the diuretic question directly. Asparagus does have gentle diuretic properties, mediated in part by a compound called asparagine, which interestingly, asparagus is actually named after. For kidney patients who are retaining fluid, experiencing edema, swelling in the legs or ankles, or have high blood pressure related to fluid overload, a gentle natural diuretic can actually be supportive. It's not the same as a prescription diuretic like furosemide, and it shouldn't replace medication prescribed by your doctor. But as a dietary component, asparagus can gently encourage urinary flow, which supports the kidney's ability to excrete waste products, including creatinine. Now, here's a critically important point. If you are on potassium-sparing diuretics like spironolactone, or if you already have high potassium levels, talk to your doctor before significantly increasing asparagus intake because it can affect electrolyte balance. This is an example of why individual medical guidance matters, and why I always encourage patients to bring a list of their foods and supplements to their nephrology appointments. Asparagus contains a compound called glutathione, one of the most powerful antioxidants produced within the human body. But asparagus is one of the few dietary sources of preformed glutathione, meaning you can actually absorb a meaningful amount from food. Glutathione is involved in protecting kidney cells from toxin-induced damage, a mechanism studied in the context of contrast nephropathy, medication-induced kidney injury, and chronic oxidative damage in CKD. Research published in the Journal of Renal Nutrition and related publications has explored the role of dietary antioxidants in CKD management, consistently finding that higher antioxidant capacity is associated with slower disease progression. Asparagus is also a source of folate, a B vitamin that supports red blood cell production. This matters particularly for kidney patients because